we're going to do the physical examination now. I've washed my hands and I've also cleaned my stethoscope. So just going to kind of talk through your general appearance just for a minute. So you're Rob Armley, you're a 39-year-old male, in today for your annual physical exam, right? No signs of acute distress looking at you here. You look well nourished, of lean, muscular build. As you were walking in, I had assessed your gait as well as your range of motion, but we'll do some more of that a little bit later. Also, your mood appears to be within normal limits. You were dressed well for the season. You appeared well groomed. So next, we had done your vital signs prior. Your temperature was 98.4. Your respirations were 18. Your pulse was 78. Your blood pressure was 120 over 70. And your oxygen saturation was 100% on room air.
That's good.
Okay. And do you remember what your height and weight was?
5'9" and about 175.
Okay, perfect. All right, so also while we were doing your health history earlier, I was assessing that you were alert and oriented ×3, so person, place, and thing, as well as your judgment was intact, as well as your memory seemed to be intact as well.
Okay.
All right, so I'm going to just start looking at your head, skin, and nails. So I'm just going to kind of come in here a little bit, and there you go. Just taking a peek, inspecting and palpating the hair, just assessing for the texture, assessing for distribution, making sure no hair is falling out. Also just feeling for any lesions, bumps, or masses, or anything like that. That looks good. I'm also going to take a peek at your skin here, just looking down your arms, inspecting and palpating, making sure I don't see any masses, lesions, rashes, any kind of abnormality there. The arms look good. Just going to take a peek here at your legs. Excellent. As well as inspecting and palpating your legs. Just going to take a peek at your chest if that's okay. Great. Okay. I'm also going to look at your back. You can leave that on if you want for some privacy. Perfect. So your skin feels good. I was also just making sure for the dryness, the turgor, and everything looks good there as well. Next, we're going to move on to the nails. So I'm just going to take a peek at your nails here, inspecting and palpating, looking for symmetry, just taking a notice of any kind of abnormalities, looking at the nail bases for the angles, also for blanching. The beds appear to be nice and pink with no evidence of cyanosis. So good. So that is the head, skin, and nails. So we're going to move on and do your head and neck exam. So while I was checking your hair, I was also just inspecting and palpating for any lesions, masses, and everything appeared well there. If you want to just get kind of comfortable and push back here a little bit, you could. And there you go. And I'm just going to be palpating the temporal arteries, which are located up here. Any tenderness when I touch there at all?
No.
Okay, good. I'm just going to take a listen. Okay. Excellent. All right. And if you can just look at me here, I'm going to be testing the temporal mandibular joint. If you can just open your mouth up and down, just check in to make sure there's no cracking or bumping or anything like that. And that all looks good. I'm going to move on to your eyes. Have you had any issues with your eyes at all? Any trouble seeing or vision or anything like that?
No.
Okay. And you had mentioned that you had your eye exam just recently. Yeah. Okay, perfect. So I'm going to just take a peek at your eyes, inspecting the external eyes, just making sure, looking at the eyebrows, the eyelashes, making sure that everything is symmetrical, which looks good there. Would you be able to just pull your eyes down like this for me? Just want to take a peek at your conjunctiva. I'm looking at the sclera. Perfect. Doesn't appear to be any yellowness there at all, so that's great. Also, next going to be testing cranial nerve 2, which is a visual acuity. So we're going to check your near and your far sight. Okay. So across the room there, I have the chart, can you just take a peek and read the furthest letters that you can?
Yes, absolutely.
Okay.
It is D-E-C-F-K-Y.
Okay, great. And then I'm just going to give this one to you here, and if
Okay.
you can just cover up one eye there, and can read the lowest line as you can.
Sure. D-P-E-C-F-D-E.
Okay, great. And can you do that with the other eye as well?
Absolutely. D-P-E-C-F-D-E.
Okay, great. Okay, there. So I'm just going to take a peek at your pupils here, okay?
Okay.
So if you want to just look straight ahead at my nose here, I'm just looking. Perfect. And they both constrict well. I also have this little piece of cotton, and I'm just going to kind of dab your, kind of go near your eye here.
Okay.
Okay. An excellent, both eyes blink, which is the normal response there. Perfect. Okay, and next I'm going to be having you cover up one eye and look at me. So there you go. And then I'm just going to kind of make some, use my little fingers here, and just let me know when you can see them, okay? When they come into view.
Yep.
Perfect. Okay.
Yep.
Perfect. Okay. Do the other eye.
Sure. Yep.
No, keep it covered.
Yep.
See it?
Yep.
Perfect. Okay, great. And so next I'm just going to be testing for conversions. So if you could just look across the room here someplace,
Okay.
and just kind of, you're going to just focus on a spot here. Actually, I'm sorry, I want to back up and just check your 6 cardinal fields first.
Okay.
So if you can look at me again and
Right.
keep your head straight, and you're just going to follow my finger, okay?
Okay.
So look here, and don't move your head, just your eyes, okay? Move your eyes, follow it to me,
And
to my finger. There you go. Okay, good. All right. So next I am going to just be looking at the anterior structure of your eyes. I don't really have my otoscope here, but I'm just going to use my pen light. Just really looking at the cornea and the lenses. Okay, so I'm just going to take a peek here from the side. Good. Okay, and your corneas appear to be clear, so that's great. I'm also taking notice of your irises and your pupils. Your pupils are round. And your irises, looks like you've got some blue eyes there. Great. Okay. And also wanted to test your pupil constriction. So I'm going to shine this light into each of your pupils just to make sure. Actually, we had done that, but I'm just going to make sure that they constrict here. Good. And so your pupils are round, equal, and reactive to light accommodation. So that's great. All right, and also with my otoscope, I would be inspecting your fundus, just looking at your optic disc, your retinal vessels, as well as your macula there.
okay.
Okay, I don't have a scope, so we're just kind of going to pretend for that one. All right, great. So let me put this back, and then we're going to go on to the ears. Okay, so any problems hearing?
No.
No changes recently?
No,
Okay.
no.
So I'm just going to expect the external parts of your ears, as well as just kind of palpate and touch them here. I'm just looking for symmetry for the color to make sure that this color is consistent with the face. Just also checking that there's no abnormalities and everything appears well. I'm going to just be assessing your pinnas here, your tragus, also your mastoid processes, and any tenderness when I touch anywhere there?
No.
Okay. And next, if I had my scope, I'd be looking into the air canal, just taking note of the canal, making sure that, that there was no inflammation or any kind of fluid in there, taking a look at your tympanic membrane, making sure that, it was no abnormalities in there. So we don't have a scope, so we're going to skip that.
Okay.
The next thing we're going to do is be testing your next cranial nerve, which is cranial nerve 8, which is your hearing acuity. So I'm going to just make some sounds, and you're going to close your eyes and just let me know what ear you hear it out if you
Okay.
can close your eyes there.
From the right,
Okay.
left, both.
Okay, great. All right. And the next thing I'm going to be doing is also checking your. I'm just going to be whispering into your ear. So I'm going to have you cover up one ear and tell me what you hear. Okay. So if you want to just cover one ear, and I'm going to whisper into this one, and then let me know what I say.
18.
Very good. Okay. Then the next one.
6.
Okay, great. All right, so cranial nerve appears to be intact, so that's great. The next thing I would do is test the Renee and the Weber test. I don't have a tuning fork, but we would just pretend here with our tuning fork. And essentially, the Renee test is testing bone conduction to air conduction. So I would hit my tuning fork. No! Ooh, jeez. And put it onto the mastoid process behind your ear. And once you didn't hear the vibration anymore, I would then quickly move it into the front of your ear to see if you could hear it there. And then I would do the same on the other side. And the next thing would be the Weber test. And again, using the tuning fork, just getting it prepared and then either placing it on top of your forehead, on top of your head, on your forehead here, just to hear the vibration, and you would let me know if it sounded different in either ear. Okay.